broadcast is now starting. All attendees are in listen-only mode.
Hello everyone, thank you for joining us today for a new session of our GESI Organized series. To remind you that the GESI Organized series serves as a platform for the GESI Network members to share experience and expertise in evidence syntheses and author translation, and to learn about potential collaborations. GoToWebinar automatically mutes all our participants, but if you have any question or comment, please feel free to submit them using the tab on the right, the questions tab. You can also use the raise your hand option, and we will give you the opportunity to give us directly your comment at the end of the session. Today's session is on Great Circle, assessing the confidence in the evidence from reviews of qualitative research with Dr. Simon Lewin. Simon is a health systems researcher at the Norwegian Institute of Public Health and the South African Medical Research Council. His work is mainly in the field of implementation research, including systematic reviews of health systems interventions, the development of and evaluation of strategies for changing professional and user behaviors, and the organization of care, and the use of lay or community health workers to deliver care. He is also the coordinating editor for the Cochrane Effective Practice and Organization of Care Review Group, EPOC. Simon, thank you for joining us today.
Thanks very much, Tamara. I'm just going to switch to my slides, which I hope people can see now.
Yes.
Let's put this away. Good. So as Tamara already said, well, firstly, my thanks to GESI for inviting me to give this seminar today. The seminar or webinar will last about 1 hour. I'm going to give a presentation of the Great CERQual approach, which will take about 25 minutes, and I hope we can spend the rest of the time having some discussion. I also just wanted to mention that this webinar builds on 3 earlier GESI webinars that some of you may have attended. An introduction to QES approaches that was given, I think, by Jay Noyes, a webinar on analyzing qualitative evidence synthesis data, and one that happened a few weeks ago on drafting findings in a qualitative evidence synthesis. I very much welcome questions and comments from you. As Tamara said, we can use both the chat box and the raise your hand option. We'll try and deal with the chat ones first, but if there's time and we're not a very large group, we may be able to take some verbal questions too. As you'll be hearing, Great CERQual very much relates to the doing of qualitative evidence syntheses. But I'm going to try in this webinar not to focus primarily on the methods for qualitative evidence synthesis, because that's been covered in some of the earlier webinars. And also, I don't think we'll have time to talk about questions related to primary qualitative research methods. And I'm just going to skip that because we've covered that already. So on to Great CERQual, which stands for Confidence in the Evidence from Reviews of Qualitative Research. So where might we be in the qualitative evidence synthesis process when you come to think about Great CERQual? You should at that point already have developed and hopefully published a protocol for your qualitative evidence synthesis. You will have undertaken the searches, screened the records identified, and also identified eligible primary qualitative studies. You will have extracted data from the studies included in your qualitative evidence synthesis, and also assessed the methodological limitations of each study using an accepted tool. And you will have already completed the data analysis phase and developed a set of qualitative evidence synthesis findings. And this really is the point at which Great CERQual comes into the picture. So why did we develop Great CERQual? As you know, systematic reviews of qualitative research are becoming increasingly common across a whole range of sectors. And they're also being used increasingly in guideline and policy development processes, for example, by organizations like the WHO, the National Institute of Clinical and Health Excellence in the UK, and other health technology agencies and guideline development groups across the world. Because of this, users need methods to assess how much confidence to place in findings from these reviews. What we know is that users tend to make these judgments anyway when you give them a piece of evidence. So it may be helpful, and this is what we're trying to do, to provide them with a systematic and transparent way for making these judgments. So how did we develop Grade CERQual? The Grade CERQual group includes researchers with backgrounds in qualitative research and systematic reviews, and we've consulted broadly with a wide range of stakeholders, other methodologists, people doing systematic reviews, as well as people using the results of systematic reviews in decision processes. What we were trying to achieve is an approach that could be applied to the typical types of qualitative study approaches and data, that was easy to use, that allowed the judgments made by the users to be reported transparently, and also allowed the judgments to be easily understood by users who may not have a background or experience in qualitative evidence synthesis. Many of you might be familiar with the GRADE approach and the GRADE working group. CERQual shares the same aim as the GRADE tool used to assess the certainty of evidence of effectiveness, but it's grounded in the principles of qualitative research, and I'll be saying a bit more about that in a few moments. We frequently get asked questions about what CERQual can be used for, so I thought it might be useful to just mention at the start that CERQual is not a tool for assessing how well an individual qualitative primary study was conducted. There are lots of other tools for doing that. It's also not a tool for assessing how well a systematic review of qualitative studies was conducted. It's not designed to assess quantitative studies of quality of care, or to assess confidence in narrative or so-called qualitative summaries of the effectiveness intervention. These are the kinds of summaries that are done in a review of intervention effectiveness where meta-analysis is not possible. So Grade CERQual is not designed for any of these. What it does do is assess transparently how much confidence to place in findings from qualitative evidence syntheses. CERQual is meant to be applied to all types of qualitative evidence syntheses, although we haven't done that yet. So far, it's been mainly used for findings from review types that use more descriptive analysis approaches, but we hope it can be applied to all types of qualitative evidence syntheses. And it's designed for use in all types of decision-making process, including guidelines such as clinical practice guidelines, health systems guidance, health technology assessments, evidence briefs, policy, and other formal and less formal decision-making processes. An important point to remember is that CERQual is applied to each individual synthesis finding from a qualitative evidence synthesis. We've defined a synthesis finding as an analytic output that describes a phenomenon or an aspect of a phenomenon. And as many of you will know, findings from qualitative evidence syntheses can be presented in the form of themes, categories, sometimes theories, and they may also be more descriptive in nature or sometimes more interpretive in nature. So they span quite a wide range and may be presented in many different ways. So what do we mean when we say confidence in the evidence? We've defined this as an assessment of the extent to which a review finding is a reasonable representation of the phenomenon of interest, the focus of your review. And what we're trying to say is that the phenomenon of interest is unlikely to be substantially different from the research finding. We think that a certain range of skills is important and necessary to apply CERQual. This includes an understanding of systematic review methodology, an understanding of the principles of qualitative research. I think it's quite hard to apply this tool well without a background in qualitative research. And our experience also suggests, and there's some evidence to back this up from studies of people using GRADE for effectiveness, that users find the approach easier over time, and that more experienced users are more likely to agree with regard to their CERQual assessments than less experienced users. So having some experience, as with many things, helps. I'm going to move on now to give you an overview of the grade circle approach. As you can see on the slide up on the screen at the moment, grade circle includes 4 assessment components: methodological limitations, coherence, adequacy, and relevance. And I'll say a little bit more about each of those in a moment. If you're familiar with the grade for effectiveness approach, you'll realize that what's missing out of those 4 is publication or dissemination bias. We are aware that dissemination bias is important in qualitative research, as in most kinds of research, but at the moment we don't have a way of assessing that, or we don't really know how to assess that within the context of a qualitative evidence synthesis. And this is why it's not yet included in the grade circle approach. And I'm very happy to say more about that issue during the question time. So now I'm going to give you a brief overview of what each of those components encompass. So imagine a scenario in which decision makers in your setting are considering a new healthcare service, but before they introduce it, they want to know whether those affected, including patients and healthcare workers, are likely to accept this new intervention. They therefore commission a systematic review of qualitative research, and you're involved in conducting it. And one of the findings of this qualitative evidence synthesis describes women's experiences of the healthcare intervention. Now, in an ideal world, what one would very much like to see in your qualitative evidence synthesis is lots of well-conducted studies that include rich, in-depth data, and they're all sort of more or less showing the same kind of thing in terms of results. But as you know, this is often not the case in a qualitative evidence synthesis. You may, for example, have identified a number of studies that are not well conducted. In other words, they have a range of methodological limitations. And where we have studies with methodological limitations, they're not as well conducted as we would like, this may decrease our confidence in a review finding. Another scenario that may arise is that you're looking for studies in relation to your question, women's views, but what you find is studies where other people are talking about women's views. Those other people may be healthcare providers reporting on what women think, or it may be those women's partners or caregivers. So this is quite a common issue that we find. We have data on our question, but it doesn't come directly from the group that we're interested in. In this sort of situation, we might be concerned about the relevance of the data. And we divide relevance concerns into 2 different areas. The one is partial relevance, where you have data that include only part of your population, and the other is indirect relevance, which is what I've just described. And I'll say a little bit more about each of those in a moment. So coming on to partial relevance, this is where you have a situation where the group of studies addresses directly the people that you're interested in, so in this case, women and their views of a healthcare issue. However, you only have a proportion of those women that you're interested in. So you only have studies of more wealthy women, or women living in a particular geographic area, or women from a particular educational group. And as you can imagine, that doesn't give us the full picture. And this is where we may have concerns about partial relevance. So if you have concerns about either indirect or partial relevance, this may decrease your confidence in a review finding. When you're conducting a review and you produce findings. Sometimes those findings are at the more descriptive end of the spectrum, as I mentioned earlier. They may just be a summary of what you've seen in each of the individual studies. In those circumstances, the relationship between the finding and the underlying studies is absolutely direct. So what we would call that is that the finding is coherent. It's a clear summary or representation of what you're seeing in the individual studies. Sometimes, however, you may choose to emphasize particular studies in your finding in order to bring out a particular issue or to highlight the views of a particular group. Where one does this, and there may be good reasons, we can discuss this later, for doing that, you may nonetheless want to indicate to the users of that review that you've emphasized particular studies in this finding, and that therefore you may have concerns about the coherence of the finding. In some instances where you've used a more interpretive approach, the finding may be a new way of looking at the data that comes from the underlying studies. In other words, you may have developed a new model or a theory based on the data from those studies. So what's coming out looks very different. And in that case, we may want to again flag to the users that we've transformed the data in particular ways. And as you know, because qualitative evidence synthesis is an interpretive process, a different review team may have come up with a slightly different interpretation of what that data means or what that model should look like. And again, that may lead us to have concerns about the review finding. The final issue relates to the adequacy of the data. So although you may have many studies included in your review, what you might find is that all of those studies include only very thin data. In other words, they have very little data about the phenomenon or issue that you're interested in, women's views. And again, when you have very thin data, this may decrease your confidence in the finding. For each CERQual component that I've described, you need to identify your concerns and whether these are on the scale from very minor to serious. And then after assessing each of those components, methodological limitations, relevance, coherence, and adequacy, we make an overall assessment of confidence in the evidence, which we've divided up into these 4 categories from very low to high. So that gives you a quick overview of the grade CERQual approach. And I'm now going to say a little bit more about each of those components. So as I mentioned, methodological limitations is the extent to which there are problems in the design or conduct of the primary studies that support a particular review finding. So bear in mind that a review finding may draw on only a subset of the studies that are included in your review as a whole. So when we're addressing making a CERQual assessment, we're looking at the studies that contributed to each individual finding. And as I mentioned earlier, we're less confident that the finding reflects a phenomenon of interest when the primary studies are shown to have problems in the way they were designed or conducted. A critical appraisal tool for qualitative studies should be used to make this assessment, and this typically includes appraisal of how the participants and settings were selected, the appropriateness of the data collection and analysis methods, researcher reflexivity, and so on. And there are many, many tools that you can use for this. We've often used the CASP tool, but there are many others available. There's no agreement on which is the best tool to use. We are doing research in this area, but at the moment we recommend that you use a tool that you're familiar with. And this is just to give you an example of what your appraisals may look at. This is a table where you can see in the rows are the individual studies included in your review, and then in the columns, the items that you're assessing for your methodological limitations assessment. So this is what you would do in advance of undertaking your grade CERQual assessment. The second component that I discussed was relevance, the extent to which the body of evidence from the primary study supporting review finding is applicable to the context specified in the review question. So typically in a systematic review question, you would need to outline what your context is. It might be geographic, health service, to do with the environment, to do with particular income groups. And what we try to assess here is the extent to which the body of evidence is applicable to the context specified in the review question. And we're less confident that the finding reflects the phenomenon of interest when the context of the primary studies that contribute to a finding are substantively different from the context of the review question. And as I mentioned earlier, the relevance may be indirect, and there are many different examples of this. One might be where you have children with one age group, but you're actually interested in another age group, or where you have one group of people reporting on the views of another. Or the relevance may be partial, where you have a subgroup of the group you're interested in. Sometimes, of course, one is uncertain about the relevance, where, for example, the ages of children in a study are not reported. The third component that I mentioned is coherence, an assessment of how clear and cogent the fit is between the data from the primary studies and the review finding. And we are less confident that a finding reflects the phenomenon of interest when some of the data contradicts the finding or some of the data is ambiguous. As I mentioned earlier, the process of creating a qualitative evidence synthesis involves transformation of the data. What we've tried to show in this diagram that's on your screen at the moment is on the left-hand side, the individual pieces of data from each of the primary studies that contributed to a systematic review finding. So as I mentioned earlier, you may just summarize that contributing data. And in those cases, it's likely that you'll have a very close fit between your review finding and the underlying data. But where you transform that data into to create a new idea or model or theory, you're moving away from the underlying data, and the match between your finding and the data may become weaker. And in those cases, those are the cases in which one might want to indicate to the user that we have potential concerns about coherence. The final component is adequacy of data, which is concerned with the degree of richness and quantity of the data supporting a review finding. And here we are less confident that the finding reflects the phenomenon of interest when the data underlying a review finding are not sufficiently rich, so you've got only thin data, or when the data come from only a small number of studies or participants. So as I mentioned earlier, although you may have many studies in your qualitative evidence synthesis, it may be that only a few of those are contributing to a particular finding. Review authors need to make a judgment on what constitutes data that are not sufficiently rich or too small in number in the context of a specific review finding. And that will depend in part on what that review finding is doing, whether it's a simple descriptive finding or a finding that's attempting, for example, to explain a phenomenon or create a causal pathway. In making an overall assessment, we look at all four of those components and sort of balance up all the concerns that we have for each of them. This leads us to an overall judgment of confidence in each review finding. And as I mentioned earlier, this ranges from high to very low. When we say we have high confidence in a finding, we mean it's highly likely that the review finding is a reasonable representation of the phenomenon of interest. In contrast, when we say we have very low confidence, and we're saying it's not at all clear whether the review finding is a reasonable representation of the phenomenon of interest. Basically, when we say we have very low confidence, we say we don't know. We recommend that users of CERQual create a CERQual qualitative evidence profile to record their assessments for each of the CERQual components, as well as their overall assessment and an explanation of that judgment. And you can see an example here on your screen where we have the review finding on the left, the list of studies that contributed to that finding, and then the judgments for each of the CERQual components, the overall CERQual assessment, and an explanation of that. And this sort of process of recording enhances the transparency of the grade CERQual assessment, and also means that it provides a record for you as a review author, so that you can come back and still recall why you made the assessment that you did. And we recommend that these qualitative evidence profiles be included as an appendix in a qualitative evidence synthesis that you publish or disseminate. For users, we've developed a simpler form called the Summary of Qualitative Findings table. This includes the review finding, your assessment of confidence in the evidence using CERQual, the explanation of that assessment that reflects your concerns about each of the components, and the list of contributing studies. And again, this is a table that's very useful for different kinds of users in a decision-making process. And for example, when we use this kind of evidence in guideline processes at WHO, this would be part of the documentation that the guideline development group would receive. So to finish off, CERQual has the potential, we believe, to facilitate reflection on findings from qualitative evidence syntheses, and to make more explicit where there are gaps or insufficient evidence in relation to a review question, and where only poor quality or studies which are poorly conducted are available. And CERQual may also prompt the generation of new explanations or concepts to explain patterns in findings. As I've tried to indicate, applying CERQual involves judgments. We try to make these judgments transparent through the reporting process, and thereby increase the contribution of qualitative research to decision making. So I'm going to stop there, and I'm very happy to take questions or comments.
Thank you so much, Simon. This has been very interesting, and a very nice way to continue the series that we've started a couple months ago. So thank you for that. So do we have any questions, or would anyone like to direct a question directly to Simon?
So please feel free to either put up your hand or to write your question in the chat dialog box, as Tamara mentioned earlier. And while you're thinking about that, I'm going to have another sip of tea.
What kind of tea is it, Simon?
It's green tea, but I kept adding water, so it's kind of dilute at this point. Could be anything. I will also just put up on the screen now some information on where you can find out more, and that may be useful.
So we have a question.
Yes.
It says, you mentioned earlier that previous webinars were related to early phases of CERQual. Do you have recording of these webinars? If yes, grateful to portray them. Yes, definitely. So, can share.
Yes, I may have misled you there. The earlier webinars were related to the earlier phases of doing a qualitative evidence synthesis. Tamara, do you want to say a bit about those, the series where people can find the recordings?
Yes, definitely. So we've had 3 earlier sessions, as Simon had mentioned earlier on, and they are all available on the GESI website, which I am sharing right now. Okay, and so if you go to the GESI website, there's a page specifically for webinars. You'll find all the recordings of previous webinars there. So the next question is, may you explain a bit about dissemination bias?
Dissemination bias, yes. I actually have another slide on that, which I will try and find. There we go. Dissemination bias is just another way of talking about publication bias. The field has tended to sort of move towards the term dissemination bias because publication is only one aspect of dissemination. You can disseminate research results in many different ways these days over the internet and so on. So what we know is that it seems likely that a fairly high proportion of the qualitative research that's undertaken worldwide is never published or disseminated. It's hard to know precisely what that proportion is. There's only, to my knowledge, been one empirical study that's looked at that, which looked at conference abstracts in a particular area of qualitative research and found that about half of the studies presented at this particular conference were never published. So anyway, whether it's half or 25%, we know that it's a substantial proportion of qualitative research is never published. In addition, those of you who've done qualitative research will know that for various reasons, to do with what the funder wants, the time available, what journals are interested in, the context. You may not publish all of your findings from a study. You may publish a proportion of them, the ones that seem most topical at the time. So this happens all the time. It becomes a problem for a qualitative evidence synthesis, and indeed for any kind of systematic review, when there's a systematic process of non-dissemination. In other words, where particular types of qualitative evidence synthesis findings or findings relating to particular questions are systematically not disseminated. And you can imagine there are lots of reasons why that may occur. Results may not be disseminated because of the topic area. So where it's a very sensitive or controversial topic, it may be very difficult to publish those results. And so there may be systematic non-dissemination. Where we have systematic non-dissemination of results, it may lead to what you can call a sort of distortion of the review finding. So in other words, if you sort of imagine a question like the one I was talking about earlier, what do women think of a particular healthcare intervention? If it turns out that all the research on refugee women is not being published because journals are not interested in it, if we create a finding about women's experiences of this healthcare intervention, it's not going to be complete. It's going to be distorted or partial. And that, of course, is a concern because it means we're not really getting a true reflection of the phenomenon of interest, a true representation of the phenomenon of interest. Now, for those of you who are familiar with systematic reviews of effects, where one's looking at things like randomized trials, non-randomized studies, we have methods like funnel plots and so on to look at the extent to which publication bias may be taking place. Unfortunately, in qualitative research, we don't have those kinds of methods yet. And we have a group within the CERQual project group that's looking at this and try to sort of think through how might we detect whether dissemination bias is taking place, and how might we take this into account when assessing review findings from qualitative evidence syntheses. So if you'd like to be part of that, you're welcome to send an email to the address that was on the screen a few moments ago. I'll put it up again in a moment. Also on the screen at the moment are two papers that we published fairly recently, which sort of say a bit more about this issue. It includes a survey that we did sort of exploring the extent to which dissemination bias is taking place in qualitative research. So I'll stop there. If anyone wants to ask a bit more about that issue, I'm happy to say more.
Okay, and so we have a question. When you have systematic reviews or reviews with mixed methodology, you evaluate just the qualitative studies or need also to make some kind of general judgment?
Okay, it hasn't come up on my screen yet, but it sounds like it's an issue to do with mixed method reviews. Yes, so this is something I was talking about with a colleague today, and it's an area that we're very interested in and needs a lot more thinking through. So as you know, when people do a so-called mixed method review, in other words, a review that includes both quantitative data and qualitative data, they may conduct that review in many different ways. And it may be that the qualitative and quantitative data are addressing different questions. So sometimes in one scenario is you have a review where you're using quantitative data, for example, from randomized trials to address questions about the effectiveness of an intervention. And then you're also using qualitative studies to address questions around, for example, the acceptability and feasibility of that intervention. So in a situation like that, you would expect to use grade for effectiveness on the effectiveness, the quantitative data, and grade CERQual on the qualitative data. Another scenario is where you have a single question, which might be something like, how satisfied are healthcare providers with the way care is organized for people with diabetes? And there you might be using quantitative data from things like surveys and qualitative data from qualitative studies using interviews and focus groups, but you try to address the same question. Now, what to do with that data is a bit more tricky, particularly if you've tried to integrate the quantitative and the qualitative findings. And we don't really have a tool available that allows us to assess the confidence of those integrated findings, or I should say we don't have a tool yet because it's something we're hoping to develop. There is at least one example in the Cochrane library of a review where they've adapted grade CERQual for those kinds of situations. Unfortunately, I can't remember what the review topic was, but Jane Noyes, N-O-Y-E-S, is one of the authors of that review. Again, you do always have the option there of using grade CERQual on the quantitative data and using another tool for the quantitative data that's suitable, for example, for data that comes from surveys. But it is an area where we need to do more work because we don't really have all the tools we need yet. Any other questions?
Yes, so if you have, next question is how to tackle the problem of partial evidence.
How to tackle the problem of partial evidence. Yes, so I'll go back to that slide where we are talking about partial evidence. So there we go. So this problem occurs quite frequently. There's actually not a lot you can do about it. You have to assume that you've done a good search of the databases and looked at the grey literature and followed up references, and that you've basically found everything that there is. So if you've found everything that there is and there's still gaps, not a lot you can do except reflect those gaps or make it clear to the user that those gaps exist when you write up the findings of your review. And this is exactly why we'd want to decrease confidence in the findings in those kinds of situations. And I can give you another example of that, which was rather interesting. We're involved in a set of reviews looking at people, healthcare providers, and users of healthcare's views around digital interventions for health, things like targeted communication via text messages or apps around health, clinical decision support, people being able to access healthcare via mobile phones through client-provided telemedicine services and so on. And what we found when we were looking at people's views about those kinds of interventions is that many of the studies are what we've called hypothetical studies. So they're studies of people who haven't actually used these interventions, but the researchers have asked them, if you were to receive information via text message about your diabetes, what would you think about that? If you were to receive information that helped you, that reminded you to take your pills, what would you think about that? And that's, so of course, it's useful information, but at the same time, having information about what people think about something they haven't actually tried is not quite as useful as having information from people who've actually done it. So that was another example of partial relevance. And in those reviews, we've had to decrease our confidence in the findings because we're not really sure that in the real world, if they were to receive those text messages, they'd respond in the same way. So we just really have to make it clear to the user that these are the limitations of this evidence. So I hope I've answered your question there, but if not, please come back with a more elaborated response. Aaron, did you say there was another question?
Yes. Next question is, can we use Grade Pro GDT for reviews of qualitative research?
Unfortunately, there isn't a module within Grade Pro or, as far as I know, any of the other platforms like Magic app for assessing how much confidence to place in findings from qualitative evidence syntheses. So in other words, to create that qualitative evidence profile and the qualitative summary of findings table. This is something that we're hoping to develop in the future, but unfortunately we don't have it yet. What we do have available at the moment are some standard spreadsheets with those sort of columns and everything set up for you. And we're very happy to make those available to anyone doing a qualitative evidence synthesis. And again, if you are doing a qualitative evidence synthesis and you'd like access to those spreadsheets and other resources, please send us an email and we'll make them give you access to that Dropbox.
Great. Next question was actually on whether there's any separate tool. Can you hear me?
Yes, I just didn't quite catch the question. Could you repeat that tomorrow?
Yes, so the question was on, if not, then would there be any separate tool? But I think the references that you talked about would actually answer all that.
A separate tool for mixed methods, is it? Or
for quality,
oh,
for
you mean for the like Grade Pro?
Mm-hmm.
Yes, what we'd like to do is have a module within Grade Pro and other platforms that allow you to, record your assessments electronically and then produce a very nice summary of qualitative findings table that can be, incorporated into a Cochrane review or another kind of review or a guideline. But we don't have that at the moment. What we have is these spreadsheets. So we're just doing that kind of thing manually for now. Hopefully we'll have that in the future.
All right, great. So any last questions? Okay, it seems like that's it.
Good.
Would you like to make any last comment, Simon?
No, just to say once again that we welcome hearing from you about your use of CERQual. We're always keen to get feedback because it is a tool that's under constant development. We have these resources that are available for users. On the previous slide, you'll also see a link to a series of papers that was published earlier this year in Implementation Science that provides detailed guidance on applying the CERQual approach. And finally, I'd just like to thank the organizations that have helped to fund this research. I'd be very grateful for their support. Yes?
Amazing.
Oh, there is one other thing. We do, the CERQual project group runs question and answer webinars about once every 6 weeks. On our website, you can see the schedule for those and you can sign up for them. So these are webinars where people come with questions about the application of grade CERQual. So they're not introductory webinars of the kind that I've done today, but there'll be at least one person from the grade CERQual group available to have a discussion with you about any questions you have about applying grade CERQual. So please feel free to register for one of those if you would like extra support. Thanks, Tamara, back to you.
Thank you so much, Simon. Thanks for this great presentation. And if anyone has any question, they can contact you. We'll also be sharing the slides and any reference paper if you'd like us to share with the attendees by email. Thank you so much, everyone, for joining us today, and stay tuned for our upcoming sessions. Thank you.
Great.
Bye now.
Thanks, everyone. Goodbye.